As you can see from the thumbnail, the image shows the consequences of diabetes. Diabetes is a very dangerous disease that can damage the body through infections, amputations, and even lead to death. Nowadays, an unhealthy lifestyle, particularly the consumption of junk food and lack of exercise, increases the risk of developing diabetes. It's important to recognize the symptoms or signs of this disease before it's too late. Prevention is better than cure. Number 1, increased thirst and urination. When there is excess glucose present in the blood, as with type 2 diabetes, the kidneys are unable to handle all of it and have to flush some out of the blood and into the urine. This results in more urine production and increased urinary frequency and urgency, known as polyuria. How it happens? 1. Excess glucose in the blood. In diabetes, the body is unable to effectively use insulin to regulate blood sugar levels. This leads to high levels of glucose in the blood, which the kidneys cannot handle. 2. Kidney response. To remove the excess glucose, the kidneys produce more urine, which increases the frequency and volume of urination. 3. Dehydration. As the body loses more water through increased urination, it becomes dehydrated. This triggers the body to produce more urine to try to replenish the lost water, creating a cycle of increased thirst and urination. 4. Sweet-smelling urine. In advanced cases of type 2 diabetes, the urine may have a sweet smell due to the high levels of glucose present. Impact on daily life. Increased thirst and urination can significantly disrupt daily activities, causing frequent trips to the bathroom, difficulty sleeping due to the need to urinate during the night, dehydration, which can lead to headaches, fatigue, and dizziness, increased water intake, which can lead to more frequent urination and a cycle of thirst and urination. Number 2, people with diabetes may experience unexplained weight loss even if they are not on a diet. This occurs because the body of a person with diabetes cannot effectively use sugar for energy, causing the body to burn fat and muscle instead. How it happens? 1. Insulin deficiency. In diabetes, especially type 1 diabetes, the body doesn't produce enough insulin. Insulin is a hormone that allows cells to absorb glucose, sugar, from the bloodstream and use it for energy. Without enough insulin, glucose accumulates in the blood and doesn't enter the cells, leading to high blood sugar levels. 2. Body burns fat and muscle for energy. When the cells can't get glucose for energy, the body starts to break down fat and muscle tissue to use as an alternative energy source. This process leads to weight loss. 3. Loss of calories through urine. High blood sugar levels can cause the kidneys to filter out excess glucose from the blood, which is then excreted in the urine. This process also leads to a loss of calories, contributing to weight loss. Number 3 is excessive hunger. While one of the previous symptoms of diabetes is weight loss, it's important to note that they are not losing weight due to a lack of food. In fact, people with diabetes often have an increased appetite and experience excessive hunger. This happens due to the following reasons. 1. Inefficient glucose utilization. In diabetes, especially type 2 diabetes, the body either doesn't produce enough insulin or the cells become resistant to insulin. Insulin is crucial for allowing glucose to enter cells to be used as energy. When this process is disrupted, glucose remains in the bloodstream instead of being used by the cells. 2. Cells starved of energy. Because the glucose isn't getting into the cells where it's needed, the cells are essentially starved of energy. The body responds to this lack of cellular energy by signaling the brain to eat more food, hoping to get the necessary glucose into the cells. 4th, slow healing wounds. For people with diabetes, wounds and infections take longer to heal. These wounds need to be properly cared for, otherwise their condition can worsen, leading to infection and even amputation, as shown in the thumbnail. Here's why this happens. 1. Nerve damage, neuropathy. High blood sugar levels can damage nerves, particularly in the feet. This condition, known as diabetic neuropathy, can cause numbness and a reduced ability to feel pain or temperature changes. As a result, minor injuries or infections may go unnoticed and untreated, allowing them to worsen. 2. Higher risk of infection. Elevated blood sugar levels can impair the immune system, making it harder for the body to fight off infections. Wounds can become infected more easily, and when combined with poor circulation and neuropathy, these infections can become severe. Number 5 is blurred vision. People with diabetes often experience blurred vision due to several factors related to high blood sugar levels. 1. Changes in eye lens. High blood sugar can cause the lens of the eye to swell with fluid, which affects the ability of the lens to focus light properly on the retina. This swelling results in blurred vision. 2. Diabetic retinopathy. Over time, high blood sugar levels can damage the blood vessels in the retina, the part of the eye that detects light and sends signals to the brain. Damaged blood vessels can leak fluid or bleed, causing the retina to swell and form deposits, leading to blurred vision.